My name is Michael Woodworth with Makari Wellness. I'm very happy and proud to say that we are San Diego's first dedicated Neuro-Vision clinic, and I am an acupuncturist with well over 15 years of experience, and I have not stopped training since the day I graduated. We have been pulling from all these various professions to create what we perceive to be the absolute most effective complementary therapy possible for so many of these neurodegenerative conditions, starting with stroke, traumatic brain injury, concussion, and neurodegenerative eye conditions like macular degeneration, both wet and dry, Stargardt's, Retinitis Pigmentosa, Diabetic retinopathy, retinal occlusions, eye stroke. All of these conditions we have great results for. Because we just opened, we're now collecting and starting to acquire our videos, so you'll see more of those for patients who are willing to share their results. But also we share the lab findings anonymously so that you can see the OCT scans of changes in the body, organic changes for conditions that people are told there's nothing they can do. Don't believe that. If you start fixing the body from the inside to the outside, you'd be amazed at what's possible. But there are no treatments for just taking drugs or surgical interventions at this point. If anyone you know has had a stroke, or perhaps yourself or a loved one, we encourage you to come in and see what we can offer them in terms of the first 10 treatments. You will be amazed. We can take people that are don't have bowel control, been bedridden for a month, haven't been able to move, and are completely depressed, sometimes suicidal, and in a lot of pain, and we can usually shut that down within the first 5 visits to where they will be a completely different demeanor, have no pain, be able to sleep, be able to control their bowels, and then we start to see that the hyperspasticity or hypertonic musculature relaxes, and we start to see them getting a much better result out of their physical and occupational therapies. For patients who have speech disorders, arthrasia, or traumatic brain injuries, or trouble comprehending language, we also have very effective treatments for the brainstem and cerebellar functions. We are continually studying with the pioneers in different fields in regards to these conditions. So right now we are pursuing a lot of training with functional neurology, looking at eye movements and how all of that eye movement training and exercises can also be used to further our treatments. And I am absolutely convinced that what we offer and what we're going to be creating as a standard of care in this country, namely just trying to catch us up to where these modern Asian countries are with their own stroke and neurological rehab. But combining that with the functional neurology, I think that is the future of these conditions, and I'm very proud to be there, and then to be also now offering tutelage to other people who want to intern after school to be able to offer this across the United States. So if you have anyone that's suffering even from an undiagnosed condition, whether it be MS, Parkinson's, ALS, they're having gait issues, cerebellar dysfunctions, it would be beneficial to at least have a free phone conversation and perhaps even begin trials. We are constantly treating things that people are told there's no treatment for, and we have measurable results. We have subjective improvement. We have been helping people stop vision loss. We help some people regain vision and hold it there. It's thought that what we do is incredible. The human body is incredible. If you know how to work with it, you give it what it needs, you give it the right stimulation. This is a medical clinic. It's not a fluffy spa clinic like some of you might be familiar with. We do a lot of work. There's work involved. And to get the results we're speaking of, we need your participation. That said, also there's rarely is ever one treatment a miracle. It won't solve these type of conditions. But we have commonly seen considerable changes in one treatment. But we work in terms of treatment packages and plans depending upon the severity and the duration of these events. So please feel free to give us a call, shoot us an email, we'll call you back when time allows. In the meantime, there's a lot out there. We're continually studying. Know that we will always bring our best to you. So in the meantime, you make well, be well, and be blessed. Thank you.